Hey everybody, welcome back to our APTA at Fight the Cut rally here on APTA Live. We're really excited that you're here joining us and helping to fight the cut and send your comments to CMS. And good afternoon for those on the East Coast, and good morning to our friends on the West Coast. We're really glad you're here, and we appreciate you taking the time to tune into our programming for this really important day of action. So we're rallying today to fight the proposed Medicare cuts to physical therapy services and the Medicare physician fee schedule, and the 15% PTA differential, and fighting to keep telehealth an option for our patients. Our push today and our goal is to submit 10,000 comments to CMS by the end of the day, or the Centers for Medicare and Medicaid Services. So we need every PT, PTA, student, patient, supporter, friend, colleague, everybody to submit comments, and we've made it as easy as possible for you to take action. We have our APTA Patient Action Center, where we have a pre-written template that you can customize and share your story on how these cuts would impact you and your patients in your practice. And all you have to do is send it right to CMS. So please take a minute to submit those comments if you haven't done so already. But I wanted to give everybody a 12:30 p.m. update here. We literally just passed 5,000 comments here about 10 minutes ago. So great job, everybody. We're really happy that you've been taking action, but we're halfway there. So we got to keep going. We have to keep the momentum up. And again, you've got to share the link on social media, get as many people as you can to do it, and really tell them that these comments do make a difference. A human being at CMS has to read each of these comments, and they have to log them, and Congress cares about how many comments are sent on this issue. So, please take the time to do this. So for this segment, we're going to talk to a physical therapist and a physical therapist assistant on the impact this policy would have on their work and patients. So first up, I want to introduce Jennifer Schneiders. She is a native of Jefferson City, Missouri, and received her Bachelor of Science in Exercise, Master of Physical Therapy, and Doctor of Physical Therapy degrees from St. Louis University. While working in outpatient clinics, Jennifer obtained multiple ergonomics and work injury prevention certifications and has extensive experience with pre-employment screening, on-site job analysis, and return-to-work therapy programs. In 2011, she founded Outbound Physical Therapy and Rehab as a mobile therapy practice treating Medicare Part B patients in their homes. Jennifer has been an APTA member and APTA Missouri member for over 20 years. And prior to being elected president in 2016 and serving as president-elect for 1 year, she served as the Central District Chair and Reimbursement Chair. She is also an active member of the private practice section and serves on the PPS Key Contact Task Force. So Jennifer, thanks for being here with us.
Thanks, Laura.
Yeah. And now I'll also introduce Margie Wen. She is a home health physical therapist assistant here in Northern Virginia, right where our APTA headquarters are. And she graduated from the PTA program at Northern Virginia Community College and is also an Old Dominion University alumna. Margie is passionate about advocating for the physical therapist assistants and student physical therapist assistants, as well as networking with minority clinicians to represent the diversity in therapy. So thank you both for being here today, and I have some questions for you that many viewers here would like to hear as well. So Jennifer, we'll start off with you, but we have the question posed to both of you. Tell us what you do and where you work and a little bit about yourself. So Jennifer, you can get us started.
Yeah, so I'm in Central Missouri. I'm in the state capital, Jefferson City. I was born and raised here and went a whole 2 hours away for physical therapy school and then came home. And I've worked here in Central Missouri for my entire career for almost 22 years. So most of my experience is in outpatient orthopedics, but I've done a little bit of skilled nursing, a little bit of work comp, and a little bit of acute, mostly because that's what my job said I had to do. So yeah, I started a private practice almost 10 years ago, and that's what I've been doing ever since then.
Wonderful. Margie, how about you?
Hi, Laura. Thanks for having me. I'm a home health physical therapist assistant in Northern Virginia, right outside of DC. I do have some outpatient ortho experience. I'm a native, born and raised here in Northern Virginia. I have a little bit of experience in also acute care, but my passion right now is definitely home health.
Wonderful. So what got you started in advocacy? And Jennifer?
So I mentioned I'm in the state capital of Missouri. And so when you're in the state capital and on your state's component board of directors, you are often called upon to show up at the Capitol for committee testimony or things that are necessary and that the lobbyists are needing. And so by default of proximity, I kind of got exposure to local advocacy and state advocacy, and then becoming chapter president. That kind of trickled over into the ability to be more tuned in to what was happening at the federal level. And it was around that time that the private practice section was starting their key contact program, around the same time that I became president. And so they were looking for not only key contacts, but also for people to help with the task force that's now a permanent committee. So I was just kind of asked to start helping with these projects, and it just kind of evolved into the advocacy I do today.
Fantastic. And Margie, I would assume your proximity to Washington, D.C. might have a little bit to do with your advocacy, but what got you started?
Just a little bit. Yeah, so I guess it started as a student. I was very involved and active in the APTA as a student, went to all the conferences, and it kind of translated over when I started my career as a practicing clinician, with continuing to go to meetings and hearing the call that there wasn't a lot of representation for PTAs and student PTAs. And I kind of, instead of asking why, I just answered my own question and why not me, and created my own platform on social media to address advocacy for PTAs and have a little bit more of showcasing and diversity, because our field is very diverse, but I don't feel that it's always represented in that way. Social media is a great networking tool, and I've met so many people just like you, Laura, and we can really make a difference. The power of social media, I think I kind of doubted it a little bit. It's amazing that, even just this platform, we can reach people all the way on the other side of the West Coast. And I've met some great people and learned a lot. It's not always just things that are problems to our field in general, but also a better understanding to help our patient and representing patient care at its fullest.
Yeah, and I agree with you that social media really is a powerful tool, and spreading this message far and wide is really important to raise awareness and raise education on what the physical therapy profession is all about. And in the work that I do, I find a lot of legislators don't really know. So it's up to us to educate them too on what you all do in your profession and the patients that you help every day. So another question for the two of you, as we know, the Medicare physician fee schedule this year has a big impact on the physical therapy profession, with the 3.5% cut to physical therapy services and the 15% PTA differential. So how will this policy impact your patients? And Jennifer, we'll start with you.
So it's definitely a daunting proposition to think about as a business owner. We're still in the midst of a pandemic, so trying to keep people working and keep patients feeling comfortable coming in the door, it's an ongoing challenge. And so it costs more and more to run a business, especially in healthcare, but we're getting paid less and less all the time. So it becomes really challenging to be a competitive employer, to offer the services that your community needs. And in the midst of a pandemic, it makes it even more challenging and difficult. Personally, I'm in private practice. I have one clinic right now. I'm trying to open a second one, but it's really difficult to find ways to offset the declining reimbursement that we get from payers. And so when there's a blanket policy that just comes in and does an automatic cut of even more, it becomes more and more challenging to keep your doors open. And then when you look at the PTA differential, just who you are able to have treat your patients becomes more challenging. I currently have a physical therapist assistant, and she is an amazing practitioner, an amazing clinician, and she's a very respected member of our team, despite only being out of school for 18 months. But if I have to weigh the benefits or the cost of doing business between a therapist who's going to get paid 100% of what the fee schedule allows versus someone who's going to get a cut, it starts to be a juggling game of who's going to be able to see patients and maximize reimbursement so that you can keep people employed. And it just gets more and more frustrating because you have the people that you need available, but you can't always utilize them the way patients need them or the way that you as an employer want to utilize them. So it's really challenging. And then staffing is a whole other issue, because in my rural community, I have a physical therapist assistant program 20 miles away. And so there's always PTAs who I know are trained well that are willing to work. But unless I have a physical therapist on site in the practice, I can't use them because I'm in private practice and I have to have the PT there first. So there's so many different complications that the payment cuts present. It makes an already complicated situation even more difficult to manage.
For sure. Margie, how about you?
I definitely feel the frustration that Jennifer just spoke of. I currently work in home health, and my goal is to get my patients safe in the home so they can transition to the outpatient setting. I'll take an example of a post-operative or a joint replacement patient. They're usually in home health for 2 to 8 weeks, if that. 6 to 8 weeks is considered long in home health, to get them safe in the house, get them safe going in and out the house, to go to their doctor's appointments, follow-ups, into outpatient therapy. The struggle I've seen with COVID is that because of the restrictions, social distancing, there's a limit on how many patients can be in a clinic setting. That's already frustrating in our profession. Now, you add on these cuts, like Jennifer said, there could be a staffing shortage. That means there's going to be less patients to be able to be seen because there's not enough staff. That's going to prevent them from rehabilitating at a appropriate time. It's a risk of infection, a risk of rehospitalization. Once the patient meets their home health goals, I can't keep them in home health. So we are already on a waiting list for many of my patients to get into outpatient. I think this cut is just going to make things a lot worse for our patients.
Yeah, we absolutely agree. And that's, part of the reason why we're doing this is just, we have to help patients get access to the care that they, very much need. And, going off the last question, and Jennifer, you alluded to this a little bit, how will this policy impact your business and your daily work? And Margie, you can take that after Jennifer.
Yeah, so I'm already trying to figure out how we're going to be able to keep everybody seeing the patients they want to see and that I want them to see, without underutilizing the PTA just because the reimbursement would be cut because they're seeing that patient. And again, I'm looking at opening a second clinic because we have continued to grow over the past 6 years, but I don't have as many physical therapist applicants as I do PTA applicants. But at the same time, I have to have that PT in place in order to hire the PTA and have them bill for services, but then they're billing for a 15% less reimbursement. That it gets really complicated and really frustrating. And at the end of the day, it's my ability to offer the appointments that patients need that's impacted.
Margie?
I'm more worried about the patient's appropriate healing time and recovery. Like I said, for a lot of my post-operative patients, it's crucial to get them into outpatient and continue their care as soon as possible without gaps. When they're waitlisted because of staffing shortage, because of COVID restrictions, they're at risk for infections and rehospitalizations, and we would start basically back at square one. And I think this is just delaying our patients getting back to their normal routine.
Absolutely. So, we have these problems, these issues that come about because of this policy, and, it's a blanket policy kind of thing. So, but we're not powerless here. We can do some things to stop it. So, if you could talk about some of your own advocacy and what you've done, and have you submitted a comment to CMS kind of thing. So, so Jennifer, what have you done in your advocacy work, and what do you really tell our viewers here of what they can do to help fight this and fight for their patients?
So I know that my congressman has been in Missouri in the district for the month of August, and so I reached out to his office. And through my advocacy efforts over the past several years, I've developed a relationship with not only my member of Congress, but also his local staff here in Jefferson City. And so I reached out to them and wondered if they would be willing to meet with me either in person or via Zoom or even a phone call. And we had a phone call, and I mostly talked about how these proposed cuts and the pay differential would impact my business personally, because my business and its well-being is of utmost importance to my congressman, as are the rest of the small businesses in our district. And so to hear specifically how being paid less to perform the same services amidst other payment cuts that have already been implemented in 2021 and a pandemic would affect the operations of my business and the ability to employ his other constituents. So that was received very well. And even though it was just a phone call, it was something that we are able to follow up on. He's connected me to the newest healthcare legislative assistant in Washington, D.C. And then I was able to mention that I will be actually coming to Washington, D.C. and kind of plant the seed ahead of time for the conversations that we'll be having in a couple of weeks.
Fantastic. Yeah, those relationships are very crucial, especially, we're sending these comments to CMS, but we know that fight probably won't end there, that we'll have to take this fight to Congress. So Congress does care about the number of comments submitted, and they'll take notice of that if, thousands of comments are going in about this. But it is educating those members of Congress and talking about, the personal impacts of your business, a local business, and their constituents. So Margie, tell us about some of the advocacy work you've done around this and what you encourage others to do, not only today for the virtual rally, but going on in our advocacy work.
I have submitted my comments to CMS actually right after Laura came on my social media, I think the beginning of August, and definitely using the APTA site to kind of guide me to understand as we grow closer to Advocacy Day, what to do, how to reach out, flyers to post, and I have the CMS comment link on my social media. I'm reposting, if not daily, every other day, and encouraging my followers, colleagues, friends to submit. It's a pre-written template. It doesn't get any easier than this. I believe they say it takes 2 minutes. I don't even know if it took me 60 seconds, to be honest. And that's with a personal comment written by myself. I hope to see local PTAs, PTs, student PTs, and student PTAs come to Capitol Hill Advocacy Day if they're registered and help us fight this fight. I think it's a lot when we get together in large numbers to make a difference. And also to follow closely on APTA. I think APTA makes it really easy to follow and perform advocacy work because the information is black and white. And getting email subscriptions daily to see what's going on, I think we can all make a little time to submit a comment.
Wonderfully said. Yeah, it does take, I submitted a comment of my own, of course. And I don't think it even took a minute as well. So I know both of you will be here for our APTA Advocacy Day on Capitol Hill. Fighting this policy is a main issue. It's the number one issue we have in our lineup of issues to present to our members of Congress. So, and Margie, you alluded to this as well. How important is it to all of us be advocating on the same day here in Washington? In a global pandemic, we might have in-person meetings, we might have virtual meetings, we might have meetings outside in a park. We're trying to do everything we can to get in front of our members of Congress, no matter how we do it. Why is this important to you? Why is it important to the profession?
It's the future of our profession. I believe year after year we get hits, and the past 2 years we've had a pandemic. It's been very hard in our profession in more ways than one, and I think when we come in together in numbers and large rallies and groups, whether that's virtual or, in person, it means a lot. It means we're serious. We mean business, and we're trying to protect our profession. And I definitely encourage students, don't feel powerless because you're not on the clinician side yet. If anything, you may have more internal connections with your clinical instructor, with your professors, and your program to really help push for these 10,000 comments.
Fantastic. Jennifer?
Oh, I just think that, like with everything else, repetition is key. And so the more we're voicing our opinions and the more that we're really driving home our message, the louder we become and the more it's going to be heard. So there's definitely strength in numbers, literally and figuratively. And the more comments we get, the more notice our congressman will make and take, and that's how we get to the action that needs to be taken. So this is just the first step in the process, but we did it last year. We minimized the damage on the proposed cuts for 2021, and we were able to at least get a lower number, which benefited everyone. And this is the same process. So we have to get all of those comments so we can get it across the finish line.
Absolutely. All right, so we're nearing the end of our time. So any parting words of encouragement or wisdom? Margie, we'll start with you.
I'm asking everybody to just take 60 seconds to just, submit a comment. It's very, very easy. APTA has the link. I have it on my social media as well. And share it. Share it on your platforms. Share it to your colleagues, classmates, and coworkers. And we really, really need your help to fight this cut.
Fantastic. Jennifer?
Yeah, the same thing. I think sharing easy links on social media and emailing your friends or emailing even your patients, giving people an easy way to take action from their cell phone is the most efficient way to do it. I was on social media, I think, or maybe it was an email yesterday, but even something from APTA came with a QR code that you could scan with your phone, and it automatically populates the letter, and you can just type in any of your own personal comments and send it away. So it's super easy to do. And I think if we share this with everyone we work with and everyone we know, then we can get there.
Thank you very much. And yeah, thank you so much for joining us and sharing your stories and experiences and why it's so important to take action. We really appreciate you being here today.
Thanks for having us, Laura.
Thank you. All right. So everybody, submit your comment right now. If you haven't already, you can submit more than once if you want to. That's not really something that should hold you back. So, join us again here on APTA Live at 6:00 p.m. Eastern, where you'll hear more about this issue and hear from our legislative and regulatory staff team on the work that they're doing on behind the scenes to fight the cut and learn more about really about the issue. We talked a little bit about the issue. They'll go a little bit more in depth on it so they can answer some of your questions that you might put in the chat on social media too. And we'll also have some closing remarks from APTA CEO Justin Moore. So he'll close out the day there, and we encourage you to not miss it. It'll be really, really great. And, once you're done submitting your comment, which I'm sure you're all doing right now or have just done, as Margie said, as Jennifer said, please share the link on social media. Social media is incredibly powerful, and you never know how many people that you can encourage to send a comment just by sharing a simple link. And, we really need everybody on board to fight this, and action on this issue is not an option. We have to have everybody taking action on this, and it's so easy to take action too. But thank you all very much for tuning in to our 12:30 update. And let me get a quick numbers update for you. All right, we got 137 comments just during our presentation here. So everybody, thank you for getting that going. We appreciate that. But, thank you for tuning in, and we'll see you back here at 6:00 p.m. Eastern tonight. So everybody have a wonderful afternoon and stay safe out there.